Did you know that there is a medication patients are scared to talk to you about? Today's we are going to talk about that medication, why patients might be scared to talk to you about it, and ways you as a physician can facilitate a discussion with your patients about this medication. So, the medication patients are scared to tell you about and how to talk to them about it. Now, we all know that patient using medications without telling their doctors is dangerous. You can have drug interactions, unknown side effects and risks. You can have untreated conditions that they might be treating the medicine with that need a different medication. You might have unknown allergies. You might have misattribution of the benefits or the side effects of this medication to a completely different treatment. You could have misuse and abuse. They could have the wrong dose. They could be a risk during surgery if the surgeon and anesthesiologist doesn't know about this medication. But there's one medicine that patients routinely hide from their doctors. In one study in JAMA Open, 26 to 35.1% of all patients admitted using it for a medical condition, but the EMR listed it in only 4.5% of patients' charts. In another study, PCPs were aware of their patients' use of this medicine only 53% of the time. So, yes. So, I'm Dr. Janice Makela. I'm a physician with over 20 years of experience. I'm board certified in geriatric medicine, hospice and palliative care, and internal medicine. I'm a hospice medical director and the host of Q&A with Dr. Makela. I'm also a physician educator. So let's get back to this. What is this medication? It's cannabis. Now, why are people so afraid of talking about cannabis? Well, first, there's fear of stigma. Yes, there are many more people using cannabis and is much more socially acceptable these days. But in one survey of medical cannabis patients, 37.8 said they thought their doctor would approve of their use. It's a very small number. And 40.2% said they were afraid of what their doctor would think about their cannabis use. So despite a social acceptance, people are still very scared of being judged by their doctor or being lectured or otherwise stigmatized for cannabis use. Then there's the fact that doctors are unable to answer questions. In one study, only 30% of oncologists felt sufficiently informed to discuss cannabis with their patients. Yet in that same study, 80% admitted they had to have discussions with their patients about cannabis. ASCO and ABIM also cite this as a problem in their recent guidelines about cannabis medicine. Then there's fear of legal consequences. Even though many states have it legally, we still have an issue in the states of federal cannabis being illegal at this time. But there's a history of disproportionate criminalization of cannabis in many communities and groups. And then there's also the issue of pregnant women being afraid of being reported to Child Protective Services. Studies show that Black women were disproportionately given drug tests in the hospital when they went to deliver their baby and were disproportionately referred to Child Protective Services if they were positive for cannabis use. So, how can doctors encourage people to talk about cannabis? Well, first, make people feel at ease talking about it. Ask about use in a non-judgmental way. Make it asking about it routine. And then avoid pejorative terms such as addict or user. And then make yourself into a resource for your patients. Educate yourself about cannabis medication. Advise on dose, frequency, indication, route, formulation, side effect, and source. And be prepared to answer questions about cannabis. If you are a resource for your patients, they'll be less likely to go to bud tenders or family or other sources and more likely to ask you and tell you about their cannabis use. Reassure patients that they are safe with you. Be aware of historical racial inequities in cannabis prosecution. Consider asking about it in the OTC medication section rather than the drugs of abuse section. When people use it inappropriately, focus on education and harm reduction strategies. Follow the ACOG guidelines about how to best help pregnant patients who use cannabis. If patients feel like you are a safe and knowledgeable resource, they will be more likely to share with you about their cannabis use and listen to your advice.